Persistent knee pain after knee surgery, whether that's an arthroscopy type of procedure or a total knee replacement procedure, is very common. Part of the reason for this is that the nerve anatomy around the knee area is quite complex. There's a lot of small sensory nerves innervating the joint, innervating the soft tissue envelope, as well as larger nerves that are passing or transiting through the knee area down into the lower leg and foot. A total knee arthroplasty procedure is a pretty brutal procedure. They cut out your old joint and put in a new one. They have to take the soft tissue and kind of reflect it away from the bone. And so these nerves are just at high risk of becoming injured as a result of the procedure, or after the fact becoming scarred in and stuck. You have to know what you're doing because this nerve anatomy, again, in this area is super variable, highly variable. You just have to be able to know how to find these nerves and where to get them. But again, diagnostic blocks are key. If you can resolve the patient's knee pain by blocking certain combination of nerves, then you know that you have probably greater than 90% chance of resolving their pain permanently by disconnecting those damaged nerves. Hip replacement, back surgery, knee replacement, ankle replacement, shoulder surgeries. These surgeries can all come about because of misdiagnoses of peripheral nerve problems. Whether that's falling on, you fall down and land on your knee on a hard surface like cement, you get kicked in the knee playing soccer, or what have you. And then what it's going to look like to regular doctors is that you have knee pain. And once that term is applied, everybody thinks about the knee joint. They think, do you have an ACL tear? Is it arthritic? Is it a meniscus tear? Is it a medial or lateral collateral ligament? That's where everybody just gets blinders on and focuses in on that. Most likely thing that's going to happen is they're going to start out by getting a knee scope, followed by another knee scope. And then depending on their age, they may be offered something more radical like a partial or total knee replacement. The problem is that if the underlying problem starts off as peripheral nerve, it doesn't matter how many orthopedic knee procedures you do on this patient, they're not going to be better. And generally speaking, they will likely be worse with each procedure because you're just exacerbating the underlying peripheral nerve problem.